What is the Level 2 Adult Social Care Certificate Qualification? Skills for Care and the Department of Health and Social Care have worked with 1,700 participants to meet the need for standardised workforce learning within the sector. This has been achieved by the introduction of the Level 2 Adult Social Care Certificate Qualification, an accredited and portable qualification designed to provide a baseline standard for care. Developed from the Care Certificate standards, it requires a formal assessment of knowledge and skills within the workplace. The qualification builds on the knowledge and skills gained in the workplaces. This, alongside an induction and care certificate standards, if the employer chooses to use them, offers a greater reassurance to both carer and employer. It has been designed to ensure people in care roles have the most up-to-date knowledge and skills required to help them succeed in their roles. The qualification also aims to ensure better consistency and standardisation in how the care certificate standards are delivered, achieved and assessed, increasing portability and reducing the need for repeated training when care workers move between employers. Did you know less than half of direct care workers hold a Level 2 or above relevant qualification? With a qualified workforce, careers in the care sector will be viewed with the professionalism they deserve. And where staff are given opportunities to invest in their career through learning and qualifications, turnover rates are significantly lower. So investing in your staff to develop their careers with qualifications like the Level 2 Adult Social Care Certificate Qualification acts as an incentive for people to join, develop and stay within the workforce. Who is it for? The qualification is available to eligible learners over the age of 16 working in adult social care. It provides the key knowledge and skills required for the new to care role in the care workforce pathway. This is a comprehensive framework designed to clearly define careers in adult social care and empower those to understand the knowledge, skills, values and behaviours essential for delivering high quality, personalised care and support. Using this, employers can decide when or if it's appropriate for a new care worker to complete the qualification, whether this be alongside employer-specific induction and mandatory training or after they've completed this. For those who don't already have a relevant qualification, the Level 2 Adult Social Care Certificate Qualification enables them to gain recognised skills and support progression in their role. And for those who already have relevant training, this qualification can solidify their knowledge. For all who complete it, the qualification provides a robust foundation to support progression into Level 3 competency in the workplace and further formal learning, including qualifications and apprenticeships.
So what's included and how can I achieve the qualification? The Level 2 Adult Social Care Certificate Qualification is delivered by a learning provider and a qualified tutor or assessor who have been approved by an awarding organisation. What is an awarding organisation? An awarding organisation adheres to standards set by the Office of Qualifications and Examinations Regulation, Ofqual. This ensures quality and formal certification trusted by employers. For those who are relatively new to working in adult social care, the qualification will take an average 6 to 8 months to complete. For those more experienced, prior learning can be contributed and reduce the time taken for completion. The qualification is achieved around day-to-day work activities and is accessible across the adult social care workforce. Learning providers will work with employers to meet different learning needs and adapt to specific working environments. The qualification contains 15 units of work, including understanding own role, own personal development, duty of care, equality, diversity, inclusion and human rights, working in a person-centered way, communication, privacy and dignity, nutrition and hydration, awareness of mental health and dementia, adult safeguarding, safeguarding children, health, safety and principles of basic life support, handling information, infection prevention and control, awareness of learning disability and autism. These units focus on both knowledge and skill. which are assessed in the workplace by a tutor or assessor to ensure full competency. The tutor or assessor will support learners throughout the process, working with employers to get the best outcomes.
How can I access the qualification? Before a learning provider can offer the Level 2 Adult Social Care qualification, they must first pass an approval process with their chosen awarding organisation. Once approved by an awarding organisation, a learning provider can then become quality assured by Skills for Care. To find a quality assured care learning service provider, employers can use the Quality Assured Care Learning Service. Provided by the Department of Health and Social Care, this service reviews the quality of courses and qualifications by each provider. This ensures that employers can choose the best quality training, working with learning providers to tailor the qualification to meet the needs of their staff. Eligible adult social care employers can access funding for the qualification from the Learning and Development Support Scheme for the Adult Social Care Workforce, or LDSS. This funding is provided by the Department of Health and Social Care. This qualification will also become part of the Adult Care Worker Apprenticeship Standard from May 2026, providing an alternative learning programme allowing trainees to achieve the qualification alongside their apprenticeship. If you're a care worker and want to learn more, you can visit the Skills for Care website for more information, or you can also talk to your employer about this great opportunity to further your learning and career progression.
How does it differ from the Care Certificate Standards? Unlike the Care Certificate Standards, the Level 2 Adult Social Care Certificate is an accredited qualification that requires a formal assessment, allowing for greater depth when learning. Induction programs for new employees must be robust to ensure that they have the right skills, knowledge, and understanding. These include statutory and mandatory training, as well as supervision, which some employers utilise the Care Certificate Standards to achieve. The Level 2 Adult Social Care Certificate qualification aims to provide standardisation of core skills and knowledge, allowing for consistency and portability for staff right at the start of a worker's career journey. An employer may decide to access the qualification alongside employee induction and mandatory training, or once they have completed the induction process. The Level 2 Adult Social Care Certificate sits alongside existing Level 2 options, such as the Level 2 Adult Care Worker Apprenticeship. Employers are encouraged to prioritise enrolling staff who currently don't hold a relevant qualification onto the Level 2 Social Care Certificate qualification. This enables the employee to gain the recognised skills and knowledge needed to support progression in their role. For staff who already have a relevant qualification, it is not necessary to complete the Level 2 Adult Social Care qualification. However, there may be instances where completing this as an additional qualification could be beneficial to both the employer and learner. The Level 2 Adult Social Care Certificate qualification specification was commissioned by the Department of Health and Social Care and developed by Skills for Care. For more information, you can visit our website or scan the QR code.